Hello everyone. Thank you so much for your continued support. In our last video, we discussed the management of care section in the NCLEX exam. In this video, we'll continue with a few more important high-yield questions from that section to strengthen your preparation. After this video, we'll be moving on to an exciting new topic: pharmacological and parenteral therapies. So, let's dive into our next question. Up next, pharmacological and parenteral therapies. Don't forget to like, subscribe, and hit the bell icon so you don't miss our next session. Drop your NCLEX topic requests in the comments. First question. A nurse is assigned to too many patients. What should they do? A. Refuse the assignment. B. Ask for clarification. C. Notify the charge nurse. D. Continue without complaint. Answer is C. Notify the charge nurse. Explanation. Patient safety comes first. Report unsafe conditions. Next question. Who is responsible for informed consent? A. RN. B. Surgeon. C. Charge nurse. D. Family. Answer is B. Surgeon. Explanation. The provider performing the procedure must explain it. Next question. What should a nurse do before teaching discharge instructions? A. Ask if they are ready. B. Wait until discharge. C. Provide written copy only. D. Skip teaching if they decline. Answer is A. Ask if they are ready. Explanation. Ensure readiness to learn for effective education. Next question. Nurse identifies abuse in a patient. Next step. A. Ask family what happened. B. Document and notify authorities. C. Ignore signs. D. Let physician handle it. Answer is B. Document and notify authorities. Explanation. Nurses are mandatory reporters of abuse. Next question. Upon discharge to a skilled nursing facility, you're gathering the patient's medical records for the patient to have a physical copy to take to the facility with them. Which of the following is not necessary to send? A. A copy of the patient's current medication list, as it will likely change at the new facility. B. An appointment with their specialist in 4 weeks. C. The patient's room number at the hospital. D. A complete history and physical. Answer is C. The patient's room number at the hospital. Explanation. It is important to provide documentation to another healthcare entity that will provide continuity of care for the patient. However, the patient's hospital room number is not necessary information. Next question. A nurse has just received report on her patients on a medical surgical unit. Which of the following patients will the nurse assess first? A. A patient on a Cardis M drip with a normal rate and rhythm. B. A patient with a history of stroke experiencing new onset facial drooping. C. A patient with COPD with an O2 sat of 89. D. A patient with an infiltrated IV that has been stopped. Answer is B. A patient with a history of stroke experiencing new onset facial drooping. Explanation. The nurse must assess the patient who is least stable. A patient with a history of strokes experiencing new facial drooping is possibly having a stroke currently and needs to be assessed immediately. Next question. A patient is scheduled for a procedure and the surgeon asks the nurse to ensure the patient understands the benefits and risks of the procedure and has signed informed consent. What is the correct response from the nurse to the surgeon? A. The patient has already signed the informed consent. B. The surgeon must obtain informed consent for the patient. C. The patient's surgery needs to be rescheduled. D. I will not obtain informed consent. Answer is B. The surgeon must obtain informed consent for the patient. Explanation. Only the surgeon to perform the surgery/procedure is allowed to obtain consent. A nurse's job is to witness the informed consent. Next question. You're caring for a patient that has an order for PRBCs. What statement by the patient would cause you the most concern? A. I feel tired and weak. B. I am starting to have chills. C. I am feeling nervous. D. I am feeling restless. Answer is B. I am starting to have chills. Explanation. A patient with PRBCs infusing who begins having chills may be experiencing an allergic reaction to the PRBCs. It is important that the PRBCs be stopped and the patient be assessed immediately. Next question. Which of the following is not a required element of informed consent for an invasive procedure? A. Risks and benefits. B. Opportunity for the patient to ask questions. C. The MD states alternative options. D. Describing the intervention. Answer is B. Opportunity for the patient to ask questions. Explanation. Medical professionals should describe the planned intervention, emphasize the patient's decision-making role, explore alternatives to the proposed intervention, and clarify the dangers of the proposed intervention as part of the process of obtaining informed consent. In this situation, discussing all hazards is essential for informed consent. Next question. A nurse is caring for a patient newly diagnosed with a stroke. The nurse forgets to give the patient his blood thinner for 2 shifts. The patient suffered a stroke the next day. Which of the following can the nurse be charged with in the court of law? A. Malpractice. B. Assault. C. Negligence. D. Failure to comply. Answer is C. Negligence. Explanation. This case presents a probable instance of nursing malpractice. When a patient suffers injury as a result of an accidental action or omission to behave as another reasonable person would, this is considered negligence. A violation of the duty of care is present. Malpractice varies from negligence in that it contains the element of purpose or intent. State laws vary, but generally speaking, any circumstance in which a nurse fails to execute his or her responsibilities adequately and harm results to the patient may be grounds for malpractice. Next question. The nurse is working at a hospital that uses a reporting system when nurses make mistakes such as wrong medication mistakes. Nurses are not necessarily in trouble when they have a report filed against them. Instead, these reports are used to ensure that others learn from the mistakes made and that they do not happen again. What is this process known as? A. Quality improvement. B. Continuity of care. C. Nurse rehabilitation. D. Employee rehabilitation. Answer is A. Quality improvement. Explanation. The process of meeting or exceeding patient expectations for treatment quality and targeted results is known as quality improvement or performance improvement. This method includes identifying issues, acquiring data, and assessing shortcomings or weak points in the care process. In order to guarantee that all of the patient's health outcomes are met, continuity of care refers to effective communication between various healthcare departments and/or agencies as well as the patient. Next question. A patient that came into the hospital originally for what he thought was pneumonia had an order for a full code. After some time in the hospital, the patient was diagnosed with stage 4 lung cancer and decided he wants to be a DNR. The wife approaches you and asks about obtaining a DNR. What is the appropriate response by the nurse? A. Are you sure that's what you and the patient want? B. When the physician gets here, I will have him come in so that we can sign the DNR together. C. Okay, let me talk to your husband so that I can be sure that this is what he wants. D. I will come speak to you and your husband and have the doctor write the DNR orders in the computer, and I'll have your husband sign. Answer is D. I will come speak to you and your husband and have the doctor write the DNR orders in the computer, and I'll have your husband sign. Explanation. It is the job of the nurse to help the patient with any legal documents that the patient desires help with about their medical care. Option D acknowledges the patient's wishes and also tells the patient and his wife what the procedure is of changing from a full code to a DNR. Next question. You're in the cath lab with a patient about to have a cardiac stent placed. The patient begins asking a lot of questions about the procedure. You check the patient's chart and see that the informed consent was not signed. What is your next intervention? A. Explain the procedure to the patient and have them sign the informed consent. B. Tell the patient that the procedure must be rescheduled. C. Call the cardiologist that will be performing the procedure to have them obtain informed consent for the patient. D. Wait until the cardiologist gets into the cath lab to obtain informed consent. Answer is C. Call the cardiologist that will be performing the procedure to have them obtain informed consent for the patient. Explanation. The surgeon performing the surgery/procedure must obtain informed consent for a patient. The nurse is only allowed to witness the informed consent. Postponing the procedure is not necessary. The informed consent needs to be obtained before the cardiologist comes into the cath lab, because once the cardiologist comes into the cath lab, they are usually ready to begin the procedure. Next question. Which of the following is not one of the 5 rights of delegation? A. Right task. B. Right personnel. C. Right communication. D. Right time. Answer is D. Right time. Explanation. Right time is a right of medication administration. The nurse delegating the task must ensure it's a task that can be delegated and to which personnel. The nurse is also responsible for the proper communication so that the task that is delegated is done properly. Next question. You're an nurse assessing an elderly adult patient with bruises that are in different stages of healing. Her caregiver is at the bedside as well. What is your most important intervention? A. Report the bruising to the physician. B. Document the bruising in the patient's chart. C. Ask the patient where she obtained the bruising. D. Ask the patient's caregiver where the patient got the bruises. Answer is A. Report the bruising to the physician. Explanation. Bruising in different stages of healing often means that the patient is being abused. This should be reported to the physician immediately. Next question. You're caring for a patient who is in a coma and intubated. He has been at the hospital for several days without any family or friends visiting. A woman shows up at the patient's bedside and states that she is his POA, power of attorney. However, the woman does not have legal paperwork proving that she is the POA of the patient. What is your response to the woman? A. You will have to bring legal documentation for the patient's chart. B. I will write you in the patient's chart as his POA. C. Once the patient wakes up, we can ask him to confirm that you are his POA. D. I will need you to prove that you are the patient's POA. Answer is A. You will have to bring legal documentation for the patient's chart. Explanation. A person cannot show up to a hospital and simply state that they have a POA of a patient. Legal documentation is needed in order for a person to make healthcare decisions on behalf of a patient. Next question. The nurse is caring for a patient who is 1 day post-op from a total hysterectomy. The patient is refusing to walk. The nurse has made every effort to encourage the patient to walk. What should the nurse do? A. Notify the physician that the patient is non-compliant. B. Document the patient's refusal in the patient's chart. C. Tell the patient that she will not be able to go home until she walks. D. Tell the patient that you will be telling the doctor of her refusal to walk. Answer is B. Document the patient's refusal in the patient's chart. Explanation. A nurse cannot make a patient walk if they are refusing. The physician should be notified of the patient's refusal, but usually if the nurse documents the refusal in the patient's chart, the physician can see it when reviewing the patient's chart. The refusal is not a reason to call the physician right away. Next question. You're the nurse caring for a homeless patient. The day for his discharge is near and he explains to you that he is worried about leaving the hospital due to lack of food and medications. Which of the following should you refer the patient to? A. Dietitian. B. Pharmacist. C. Social worker. D. Chaplain. Answer is C. Social worker. Explanation. A social worker can be a great resource for patients. Social workers can help with things such as insurance, food waivers, transportation resources, and so much more. Next question. You're caring for a patient with multiple wounds that need daily dressings, uncontrolled diabetes, mellitus type 2, and uncontrolled hypertension. The patient is mentally competent and states that he wants to leave now and threatens to become hostile. What should you do as the nurse? A. Obtain AMA forms and inform the doctor of the patient's wishes. B. Explain to the patient that you cannot let him leave in his condition. C. Call a taxi for the. D. Have a chaplain come speak to the patient. Answer is A. Obtain AMA forms and inform the doctor of the patient's wishes. Explanation. A patient who is in a healthy mental state is allowed to leave the hospital against medical advice. The doctor must be notified. The AMA papers should be obtained and signed by the patient and the healthcare team. Next question. You're caring for a patient who is leaving the hospital with daily wound care orders, home oxygen, and a PICC line for daily IV antibiotics. Which member of the healthcare team can most effectively assist this patient in obtaining all things needed to go home and have continued care? A. Occupational therapist. B. Case manager. C. Charge nurse. D. DME company. Answer is B. Case manager. Explanation. The case manager is a liaison to help a patient transition from hospital care to home care as easily as possible. They can set up a patient with home health that needs things like wound care, home oxygen, and daily antibiotics. Next question. You receive orders for penicillin G for a patient who has an allergy to penicillin listed in his chart. What should your initial step be? A. Report the doctor to the Board of Medicine for malpractice. B. Clarify the order with the doctor. C. Refuse the order and do not give to the patient. D. Tell the patient the doctor is incompetent. Answer is B. Clarify the order with the doctor. Explanation. If a patient has an allergy to a medication that has been prescribed, the order should always be clarified with the doctor. When in doubt, always clarify an order with the doctor that wrote the order. Next question. You are a nurse on a medical surgical floor with 4 patients with medications due at 9 a.m. Which of the following patients will you administer medications to first? A. A patient taking lactulose for high levels of ammonia upon hospital admission 3 days ago. B. A patient taking Humulin R that is about to receive their breakfast. C. A patient on Demerol for post-op pain with a pain level of 510. D. A patient on metoprolol for a chronic history of irregular heart rhythm. Answer is B. A patient taking Humulin R that is about to receive their breakfast. Explanation. Regular insulin for diabetic patients should be delivered 15 to 30 minutes before the meal. This medicine administration is urgent and time-sensitive. Instead of prioritizing medications merely on the basis of age, priority should be given to the illnesses they treat and the status of the client who needs them. Next question. You're receiving report on your patients on a medical surgical unit. A patient's family member yells from a patient's bedside, "He's not breathing." What is your initial response? A. Have the nurse that is taking over the patient assess the patient. B. Stop report and assess the patient. C. Ask the family member to wait until you're done receiving report. D. Have the nurse aide assess the patient while you are receiving report. Answer is B. Stop report and assess the patient. Explanation. The patient is in immediate need of nursing help. No matter who is taking over care of the patient, the nurse's priority should be assessing the patient. Next question. Which of the following patients should be assessed first? A. A patient with a chest tube with a water-sealed chamber that is dry. B. A patient with a Foley catheter bag that is overly full. C. A patient with stable AFib. D. A patient with COPD sleeping with a pulse ox of 90%. Answer is A. A patient with a chest tube with a water-sealed chamber that is dry. Explanation. The patient with the chest tube with a dry water-sealed chamber should be seen first because an improperly working chest tube can cause respiratory distress in a patient. The overly full Foley catheter bag can be delegated to a UAP. Option C states that the patient is stable. Option D is also a stable patient. Next question. You're caring for a female patient that insists that the male nurse on the previous shift was inappropriate with her. What is your best response to the patient? A. How was he inappropriate with you? B. I can report this to our charge nurse and have her come speak to you so that you can tell her your concerns. C. I will speak to him about that. I am so sorry that he made you feel uncomfortable. D. I will report him to the Board of Nursing. Answer is B. I can report this to our charge nurse and have her come speak to you so that you can tell her your concerns. Explanation. The nurse should always validate the patient's concerns. The nurse should never take it upon herself to talk to the offender. Nurse. Reporting the nurse to the Board of Nursing without knowledge of what was said/done is not appropriate. Reporting the situation to the charge nurse is the best option. Next question. You're running behind during your morning medication pass because several patients needed PRN pain medications. What is an appropriate task to delegate to the LPN on the unit? A. Ask the LPN to take vital signs on a patient with unstable hypertension and a suspected stroke. B. Administer IV penicillin to a patient with a CVL. C. Ask the LPN to administer IM Phenergan to a patient with nausea. D. Ask the LPN to assess a post-op patient with an abdominal binder on. Answer is C. Ask the LPN to administer IM Phenergan to a patient with nausea. Explanation. The LPN may administer most IM drugs. The LPN should not obtain vitals on a patient who is unstable, as in option A LPNs are unable to access a CVL or PIC. Option D suggests that the LPN assess. Assessment is the duty of the RN. Next question. A patient comes into the ED complaining of chest pain that radiates down his left arm. His verses are as follows: HR 140, SAO 298%, RR 22, and BP 145/95. What is your priority? A. Recheck the BP. B. Get an EKG. C. Administer oxygen. D. Start a 20-gauge IV. Answer is B. Get an EKG. Explanation. This patient is having symptoms of an MI and should have an EKG done immediately. The other options are correct but are not most important. Next question. You notice that there is a blood spill in the hallway on your unit. What is your initial intervention? A. Call EVS. B. Call the biohazard team. C. Wipe the blood up and clean with the proper wipes. D. Place a caution cone beside the spill and call EVS. Answer is C. Wipe the blood up and clean with the proper wipes. Explanation. Calling EVS is okay, but to keep patients and visitors safe, the blood spill needs to be wiped up immediately. Linens used to wipe up the blood should be placed in a red biohazard bag. Next question. Which action demonstrates advocacy? A. Following all orders. B. Reporting unsafe staffing. C. Avoiding conflict. D. Delegating assessments. Answer is B. Reporting unsafe staffing. Explanation. Advocacy includes ensuring patient safety. Next question. A nurse manager's best method to reduce conflict is: A. Ignoring complaints. B. Immediate termination. C. Holding open meetings. D. Discouraging feedback. Answer is C. Holding open meetings. Explanation. Transparency prevents escalation. When planning assignments, which client goes to the LPN? A. A new diabetic. B. A client needing formorphine. C. A stable client on oral meds. D. A client in acute distress. Answer is C. A stable client on oral meds. Explanation. LPNs can manage stable patients with predictable needs. Next question. A nurse makes an error. What's the first step? A. Report to the provider. B. Fill out an incident report. C. Inform the patient. D. Monitor the patient. Answer is D. Monitor the patient. Explanation. Ensure patient safety first, then report. Next question. What is the primary goal of case management? A. Reduce RN workload. B. Cut hospital costs. C. Coordinate quality, cost-effective care. D. Replace primary nursing. Answer is C. Coordinate quality, cost-effective care. Explanation. Case management ensures comprehensive, efficient care. Next question. A nurse is precepting a new RN. The priority is to: A. Assign complex cases. B. Provide limited feedback. C. Guide and observe. D. Let them work independently. Answer is C. Guide and observe. Explanation. Support builds competence and confidence. Thank you for watching our channel. If you enjoyed the video, don't forget to like, comment, share, and subscribe for more great content. Your support means the world to us.